Hello everyone, my name's Alex and I'm a physiotherapist from Physio Function, and I'm going to be taking this level 1 different strokes exercise class today. So for anyone who's new, level 1 classes are designed for individuals who may have no movement in their affected arm or leg. It's a seated class, so there'll be no standing at all in this class. Please be aware that we do ask for you to have somebody there to assist you with exercises as needed. So guys, sadly, this is going to be my last week doing these level 1 different strokes exercise classes. And next week, you're going to have one of my colleagues at Physio Function taking over. I just want to say thank you to everybody that's joined me for these classes. It's been wonderful to see everybody and hear everybody's comments and feedback. And I just want to say it's awesome that you guys are joining me with these week by week. I'm going to really miss working out with you all. I wish you all the very, very best going forwards with your fitness and exercise and rehab journeys. So what we're going to do for this last class with me, we're going to do a full body workout. So we're just going to hit most of the muscles in our body, okay, in a circuit format. So you should get a good full body workout. So we're going to start with a warm-up in sitting, and then we're going to go through a series of exercises in sitting, working on our arms, our legs, our core, and we're going to try and repeat that twice. We're then going to finish with a cool down. So I want you to firstly start by joining me in a nice upright posture. So feet flat on the floor if you can, underneath your knees. If this is a bit tricky for you, if you're in a wheelchair, then if you've got your footrests, or if you need to pop something underneath your feet on the floor, so this could be some books or something sturdy, then you can have those ones underneath your feet to get this nice grounded position. Nice and tall, back away from the chair, or as little support going through the back press as possible, shoulders back and down. Let's do some nice big shoulder rolls up, back and down. Really trying here to get your affected side to join in as much as you can. Just working on that symmetry, even if it's flickers of movement, remember it doesn't matter. Really nice, guys, well done. Good, and let's have our hands. We can get our elbows involved a little bit if we can, so supporting with your unaffected side. Good. Let's see if we can change direction, so shoulder rolls forward. Really nice. Good. And relax those hands down. Let's place them on our right knee. Gently turn from your waist, so you're not pulling with your hands. We're going to turn to look over our right shoulder. Take a nice big breath in and out here. Good. Back to center. Hands on the left knee. Turn to look over that left shoulder. Big breath in and out here. Really think about breathing into that right side body. Good. Back to the right. Turn to look over that right shoulder. Big breath into that left side body, really down to the bottom of those ribs. Good. Back to the left. Turn to look over that left shoulder. Big breath into those right ribs. Good. Back to the middle. Hands on your knees. Let's grow tall. Squeeze shoulders back and down. Big breath in. Breathe out. Reach your hands forward. Round that upper back. Option to drop that head, chin to chest. Breath in. Squeeze shoulders back together. Grow tall. Breathe out as you reach hands forward. Round that back. Option to drop that head. One more. Breath in. Grow tall. Squeeze shoulders back together. Breathe out. Reach arms forward. Round upper back. And then let's grow tall. Find that nice upright posture again. Okay, hands on your knees or on the arms of your chair. Let's side bend to the right. Now think of lifting those left ribs up and away from your pelvis. You can always let your neck relax a little bit for a side neck stretch. Come back to center, nice and slowly. Over to the left. So think about lifting those right ribs up and away from your pelvis. So feeling that length through your right side body. Back to center. Over to the right. Left ribs lift up and away from your pelvis. Good. Back to center. Over to the left. Lovely. Back to center. Fantastic. Okay, let's now have our right leg out straight, or as straight as it can be. So from the side, look like this. Okay, you're going to sit nice and tall. You can have one of your hands on your chair, or you can have your hands on your knee. We're just going to gently do some little leans forwards and back. So here, we're keeping our back straight. Okay, we're doing a gentle lean forward and coming back up. Just feeling a gentle stretch in that hamstring. You can always, if you've got the movement, you can always do some backwards sweeping with your arm. You just do this with your unaffected arm. Depends how good your balance is. Or you can just do those gentle lean forward and backs. We're not forcing anything here, just a little gentle dynamic stretch of your hamstring. You shouldn't be pushing it to the real tightness either, just really gently warming it up. And then let's change legs. So let's have left leg straight, right knee bent, hands on the bent knee. Sit tall, lean forward and back just gently. Remember, you can have that backward cycling motion happening if you want. Good. Keep it going. Do a couple more. Last one. And relax. Okay. Sitting tall in your chair. Let's think about pushing down into our toes to lift our heels and then picking up our toes. So we're rocking forward and backward on our feet. Just joining in as much as you can on your affected side. Just thinking about the motion and the movement. Really nice, guys. Good. Rocking forward and back. Lovely. Do a few more here. Good. And then let's do some marching. So marching those arms and legs. Again, just joining it as much as you can with your affected side. Lovely. Keep it going. Remember, we're just doing our warm-up, so we're just getting all the blood going to the muscles. Getting our heart and our breathing rate up a little bit, preparing us for exercise. Also wanting to warm the muscles, make sure that they're able to move, reduce the risk of injury. Lovely, guys. Good. Now let's have feet nice and wide, reaches opposite side of our body, cross body. Good. Again, just moving with your arms as much as you can, trying to join in with your affected side. Good, keep it going. Now we're going to do a few more. And then I'm going to chat through our circuit. And rest. Fabulous. Okay, so the circuit we're going to do today, we're going to do a series of exercises. We're going to go through the circuit twice. We're going to do 45 seconds per exercise with the rest between. The first one we're going to do, we're just going to focus on one leg at a time here. So I want you to focus on your right leg. So whether that's your affected side or your unaffected side, we're going to be squeezing the knee, trying to straighten that leg, pick the foot off the floor if you can. If it's your affected side, I want you just to do as much movement as possible, even if you're able to slide your leg slightly forward and back. Or have your leg out, you can have your hands underneath and just think about squeezing that thigh muscle. So even if you don't manage to pick your foot up off the floor, I want you to think about squeezing and tensing that thigh muscle. So you can just put your finger in it and really think about squeezing it. Think about seeing or feeling the muscle tightening underneath your finger. So as if you're trying to clench, if you're trying to straighten your leg. So that's your options there. So it's your, so just doing whatever you can. And when you are, if you're unable to pick your foot up off the floor, but you've got a little bit of activity, even if it's flickers, or even if it's nothing, I want you just to have a look at it, think about the movement, think about the leg working. You could even do your other leg at the same time and really think about that affected side joining in, just to really try and get those wires, that rewiring those messages from your brain to your muscle. Okay, so we're going to go for 45 seconds on our right leg. You ready? 3, 2, 1, off we go. So we're straightening, picking our foot up and down. Or we're just thinking about that muscle squeezing. I want you to try and stay nice and tall here as well. So sitting nice and upright. So it's a really good core workout as well. You can do it without holding on. It's a real challenge for your tummy muscles. Good. Lovely, guys. If you have your hands there, just try and have them lightly there for balance. Tummy's tight. Good. Bending and straightening and lowering that leg. Do one more. And relax. Fantastic. So the next round, we'll do your other leg. Okay, the next exercise we're going to do is a seated deadlift. So it's a hip hinge here. So this is a really useful exercise if you need to be picking something up off the ground. It's working on that hip hinging pattern, which is really important. So I'm going to show you from the side here. So sitting nice and tall on your chair, back is straight. You can have your hands resting down by your side. Now, if you want, if this is really difficult, I'll get you that you can use your hands on walking up and down your legs. Okay, so that's option 1. If you struggle with this leaning forward and coming back motion, you can walk your hands down your legs. You're trying to keep your chest and your head up and your back straight, walking hands up and back. If that's okay, if you can lean forward and back without losing your balance, have your hands down by your side, chest up, back up. We're just going to lean forward as if you're reaching down towards your ankles and then come back up. So reaching down, using your back muscles to come back up. We're trying to keep our back straight. So what I don't want is I don't want you to collapse and your back to round. I want you just to go as far forward as you can, keeping your back straight, your head up, and then come back up. Okay? So pick your option. Either way, we're really working on tummy muscles to support our back. Shoulders are back, head up. Okay? If your head goes down, that encourages you to come into that rounded position. So try and keep your head up and your eyes up as you're hinging. Okay, we ready? Set, off we go. So we're here, reaching, and then coming back up. Nice and controlled, or you can be walking your hands down your legs. That little bit of extra support. Good. Well done, guys. Nice and strong. Last one here. And up. Lovely. Okay. The next exercise we're going to do is a hamstring curl. So again, we're going to stick to the right leg this time and do our left leg the next round. So what we're doing is we're trying to bend and slide that right leg behind us and then forward. So you could always have a plastic bag underneath your foot to help with the sliding here, or you could always just take your shoe off so you've got your sock slipper on the carpet. We're trying to think about sliding that leg back. Now, if this is your affected side and you need a bit of help, I'll show you on this leg. You could gently try and sort of support with your other hand to try and de-weight that leg a little bit and give it a bit of an assistance. But try and do as much as you can with your affected side. Always trying to think, even if it's flickers, you want to try and embrace those, okay? You want to try and get any sort of flickers of movement you can. You're really trying to harness that and work on that. Okay, 45 seconds. In 3, 2, 1, off we go. So slide that right leg back, really think about squeezing the muscles at the back of your thigh, so those hamstring muscles, and forward. You could always have your assistant guiding this movement, okay? Again, they're trying to let you lead it. Good. Forward and back. Really nice, nearly there. Lovely. Couple more. Good. Last one. And rest. Awesome. Okay. Next one we're going to do is an upper body exercise. So hands are going to be together, sitting nice and tall in your chair. You're going to reach those hands forward, pull those elbows back. Reaching them forward, pulling those elbows back. So you could always have your hands, if you want, sliding along your lap if it's a bit, you can't have your arms up here, you could bring them lower. You're just working wherever is a range for you that's achievable, that it's not causing you any pain or discomfort. And remember, you're trying to think about both arms working together rather than pulling on that affected arm. You could always have your assistant providing a bit of support underneath your elbow and forearm. They could always guide your affected arm if you wanted to have your hands separate, supporting wrist and elbow. But remember, you're never pulling on your arm, they're just guiding, you're trying to initiate the movement, okay? You're trying to lead the whole thing. Right, so we're going to go 45 seconds, chest press position in 3, 2, 1, off we go. So reaching our arms forward and then back. Reaching them forward and then back. Nice and controlled, body nice and upright. Really think about those arms moving together, straightening those elbows. Good. And back. Lovely, guys. Keep it going. Good. Nice, everybody. And rest. Fantastic. Okay. Next one we're going to do is a row. So we're going to lean our bodies forward ever so slightly, okay? So if this is a bit tricky, then I'll show you another option. Hands down by our side, thinking about, if you can, as much as you can, making a fist and then pulling those elbows back. So as if you're starting up a lawnmower, okay? You're an old-fashioned lawnmower, okay? Right, we go, starting up that lawnmower or that chainsaw. That's the chainsaw movement. Okay, pulling back. And then down. Good. Okay, really working on squeezing the shoulders. If that's a bit tricky, you can be upright. And again, you're just pulling those elbows back, squeezing shoulders back together, hands are clasped. Okay, doing this movement here. Okay, really thinking about the pull back rather than the reach forward. Okay, 45 seconds, pick your option. Off we go. Make sure your back is straight, your head and your chest are up. Excuse me. Pull those shoulders back together. Lovely. Really nice. Keep it going. Lovely, guys. Good. That's it. Keep it going. Pull back, pull forward and rest. Good. Okay. One more exercise for our tummy muscles. That's a sit up and a punch. So you're going to sit forward in your chair as much as you can. Okay, but making sure you're safely on the chair still. Lean back. We're going to have hands together. We're going to sit up. We're going to go punch, punch, rest back. So we're really trying to use our tummy muscles here. Get a bit of cardio there with some punching. Okay, to get our heart rate up a little bit before we go on to our second side. Okay, so sitting nice and tall at the front of your chair, 45 seconds. Gonna go in 3, 2, 1, off we go. Sit up, punch, punch. Good, so working at your own pace here. Lovely. Good guys, keep it going. Remember, really using those tummy muscles to try and control your lie back. So try not to flop back in your chair. Good. Lovely. Good, guys. And rest. Lovely. Okay. Have a break. Grab yourselves a drink. And then we're going to go right back to the top again. So back to that leg straightening exercise, the first one, but we're going to work on the left leg this time. So hopefully everyone's feeling okay. One more round. Excuse me. Oh, okay, so we'll have about another 15 seconds rest. If you need a bit longer, please feel free to pause the video, okay, and to have a little bit longer, join back in whenever you're ready. Okay, so when we're ready, we're going to do that leg straightening and back. Remember, if it's your affected side, you could just focus on squeezing that thigh muscle. We're thinking about that movement, just lifting off floor if you can. If not, we're just thinking about that thigh muscle working. Nice and tall, good posture here. Ready? We're going to go in 3, 2, 1. Off you go. Squeezing and straightening, stay nice and tall. You can lift that foot up as well. You can also do that. Good. Really nice, guys. Lovely. Keep it going. Wonderful. Last one. And rest. Fantastic. Okay, we're going back to that seated deadlift. So remember, we're walking, that hip hinging, walking arms down and then back up, keeping our back straight. Or if that's too easy, you're bending forward, reaching down, and then coming back up, keeping that head up, the shoulders are back, to keep the back nice and straight as we do that hip hinging movement. So get your breath. Okay, we're going to go in 3, 2, 1, off we go. So we're hinging, standing back up. Good, really, this is a really good one working on your back muscles. You can also, as you go down, then squeeze your bottom muscles to support your back to come back up. Squeeze your bottom muscles as you come back up. Squeeze. Good. That's it, really squeeze those bottom muscles, use those back muscles. Head and chest are up. Lovely, guys, keep it going. Got 5 seconds. Good, let's do one more. Awesome. Fantastic. Okay. Next one we're going to do is that hamstring curl. So this time on our left leg. So remember, we're sliding that heel back towards our bottom. So bending that knee, muscles at the back of the thigh working and then coming forward. You can always support that leg a little bit to help it, or your assistant could be guiding the movement, but you're trying to do as much as you can, really thinking about those muscles at the back of your thigh working. Okay, slightly longer, rest. Okay, and then we're going to go in 3, 2, 1, off we go. Slide that leg back and then forward. Remember, you could have your shoe off to slide, or you could have a plastic bag underneath your foot. Sliding back and then forward. Lovely. Keep it going. Good, guys. Really nice. Keep it going. Sit. You've got 10 seconds. Sit. Let's do one more. We'll finish the one you're on. And rest. Awesome. Okay, on to our upper limb exercises. So we're going to be doing our forward reach with our hands and back. Reaching forward. Remember, trying to keep that nice symmetrical working, really focusing on your attention on your affected side, really trying to get that arm to do as much as it can. Even if there's not much movement, any flickers, remember, you're trying to really utilize those and get whatever activity you have working. Okay, we're going to go in 3, 2, 1. Reaching forward, stretching, think about straightening those elbows. Remember, you don't have to have your arms straight out in front. They could be lower on a diagonal. Really think about straightening those elbows. We're just trying to imagine that forward reaching motion. Good, keep it going. Think about both arms working together. Lovely. Keep it going. Forward and back. Really nice. Good. And rest there. Okay, we're nearly there now. 2 more exercises to go. So we've got our rows. Remember, we could be here. We're pulling our elbows back, squeezing shoulder blades back together, reaching arms, pulling back. So the focus, it seems very similar to the last one. Sorry. But the focus is on the pull back, squeeze shoulders back rather than the reach forward. Or we can be hinged forward and we're making fists and we're pulling those elbows back. Think about squeezing those shoulder blades back together. So pick whichever option you're going to do. We're going to go 3, 2, 1. Off we go. Pulling back and forward. Really nice. Lovely, guys. Keep it going. Good. Now pulling back, squeeze shoulders, elbows back together. Lovely, guys. Keep it going. Good. That's it. Really think about those shoulders, elbows, squeezing back together. Let's do one more. Good. And rest. Fantastic. Last exercise is those sit-ups. So again, shuffling your bottom forward to the front of your chair, leaning back. Have one moment here just to get your breath, and then we're doing that sit-up with the 2 punches. Okay, you ready? Final push. 3, 2, 1. Off we go. Sit up, punch, punch. Good. Fantastic. Keep it going. Lovely, guys. Keep it going. Sit up, punch, punch. Good. Lovely. Nearly there. Last one. And relax. Well done. Awesome work, everybody. So get yourself set up in a nice, comfortable upright position in your chair. We're going to do our cool down stretches now. So again, shuffle your bottom forward. Have your right leg straight, your left leg bent. Hands on your bent knee. Sit nice and tall. And then hinge forward at your hips, keeping your back straight until you feel a stretch down the back of that straight leg. Hold that there. Nice big breaths. Good. Lovely work. And then let's change legs. Left leg straight, right leg bent. Sit nice and tall. Hinge forward at those hips. Lovely. Good. Awesome work. Feel that stretch down the back of the leg. Keep breathing. And relax. Bring those legs back in. Hands fast together. Let's reach those arms forward. Round that upper back. Option to drop your head. Feel that stretch across your back. Hold that there. We breathe into that back body. Good. Good. And let's bring those hands as far back to the base of your back as you can, or you can slide them back on your lap. Elbows squeezing back together, shoulders squeezing back together, opening up that chest. Hold that there. Lovely. Good. Big breath in. And then relax. Lovely. Give yourselves a clap, a pat on the back. Well done, guys. Thank you so much for joining me today for this level 1 different stroke exercise class. And thank you to everyone that's joined me for all the other classes in the past. It's been an absolute pleasure leading these classes for you. And I wish you all the absolute very best ongoing in your exercise journey. So again, thank you so much and have a fantastic rest of your week. And I wish everybody the absolute best. Thank you, guys. Bye.